Hi, my name is Katie. I'm 33 years old, and I was diagnosed with cystic fibrosis when I was 7 months old. I live in Perry Hall, Maryland, about 20 minutes from outside of Baltimore. So I truly have always wanted to be a mom when I never just thought I'd get the chance because when I was born, my parents were told I wouldn't live past 13, most likely. So I think it was just always a dream of mine that I would become a mom, although I didn't think my life expectancy was going to allow for it. So I started taking the triple combination therapy in 2019, and I've noticed so many changes in my life since then. First of all, I was able to take a deep breath for the first time in my life. I have a dry cough for the first time in my life. I'm no longer spitting up mucus all the time. I also had my lung function went from around 56% all the way to its highest that it's at now at 104%, and it's been consistently around there for the last almost 5 years, which is incredible. And then also, I was a little fearful about my ability to get pregnant when I started taking it, just because of all the unknowns that comes with it. First of all, I talked with my CF doctors just to get their input as to whether or not they thought it was a good idea, and what complications I could expect with getting pregnant and being on the triple combination therapy. I also spoke with a genetic counselor, just to see what are the odds of my future children having cystic fibrosis. And then also my husband went and got tested so that we could really see whether or not the chances of our baby having CF would be high or not. So we went through all those avenues. And then the CF doctors were pretty confident about me being able to become pregnant due to my lung function being higher because of the triple combination therapy. So going into it, everyone was kind of on the same page, and we were all pretty confident about me trying to conceive. Yes. So ultimately, I did decide to stay on the triple combination therapy while I was pregnant. I did have some concerns with it because when I talked to my CF doctors about it, they said that there hasn't been enough study to be able to tell whether or not there would be any effects on my baby or myself. So it was really a personal decision whether or not me and my husband felt comfortable me staying on it. But ultimately, we decided that healthy mom, healthy baby. So the fact that I was the healthiest I could ever be on the triple combination therapy, we decided that it was best for me to continue it. And I'm thankful that I did because even my OBGYN said that I was the healthiest pregnant patient that had CF that she has ever seen. So that was really, 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 really reassuring. And then also both of my babies don't have cystic fibrosis and haven't had any complications since I stayed on the medication while pregnant with them. So, in my family, I'm actually one of four siblings. Both of my parents are CF carriers, and none of my siblings have cystic fibrosis except for me. So, my parents are actually, or my family is the exact statistic that they talk about with cystic fibrosis. Both my parents are carriers, and they had four children, and I'm the fourth, and I have cystic fibrosis. That's just something interesting to note. And then also, my current family now, I am been married for 5 years now with my husband, and we have two beautiful kids. We have a 4-year-old boy named Liam and a 2-year-old girl named Lucy. They're truly the light of my life. And they're so much fun. And I just feel so grateful for the triple combination therapy because it allowed me to be a mom and it allows me to be as healthy as I am today and to be able to run around with my kids. And really, it's made like all of my dreams come true. So I'm just so thankful for it.